This is part 2 of your tobacco lecture. Next, let's take a look at smokeless tobacco. Here we're talking about loose leaf tobacco that is usually placed between the lip and the gum or the cheek and the gum and either sucked or chewed and then spit out. You may hear it also referred to as chewing tobacco or spit tobacco. And some may perceive smokeless tobacco as safer because you're not smoking it. But in fact, it does carry many risks, including addiction because it does contain nicotine. So there is dependence and tolerance. There's also a risk for other health problems, including cancer of the oral cavity, and cancer of the pancreas are increased. And aside from nicotine, there are at least 28 cancer-causing agents found in smokeless tobacco, and youngsters who use smokeless tobacco are more likely to become cigarette smokers. Other risks for smokeless tobacco are women who use during pregnancy. There's an increased risk for SIDS, low birth weight, preeclampsia, and premature birth. Other reproductive problems can occur with men having low sperm count or abnormal sperm cells. Lastly, smokeless tobacco is associated with poor dental health, including receding gums, gum disease, and tooth decay. Next, let's take a look at secondhand smoke. So, what is secondhand smoke? Sometimes referred to as environmental tobacco smoke or ETS. And this is in fact categorized as a group A carcinogen, which is the most dangerous class of carcinogens. So secondhand smoke or ETS refers to the passive inhalation of smoke because you're in an environment where people are smoking. It may be a common environment like the workplace, or it may be your home. So individuals that are living with a smoker or working in an environment where there's a lot of smoking going on, either indoors or in the outdoor working environment, are at increased risk for heart disease, cancer, and other health conditions. Secondhand smoke exposure causes an estimated 46,000 heart disease deaths annually in the U.S. And the Surgeon General asserts that since 1964, that 2.5 million adults who are non-smokers died because of ETS. Some of the health effects are similar to firsthand smoke, which are risks for lung cancer, heart disease, and stroke, also irritation of the ear and nasal canal, respiratory problems, those pregnancy-related consequences, and other reproductive consequences. Specifically with children, ETS puts you at increased risk for asthma, respiratory infections, ear infections, and those pregnancy-related conditions that we talked about. In adults, again, greater risk for heart disease, stroke, and lung cancer. Lastly, let's talk about quitting. The take-home message here is that it's never too late. If you quit smoking or using tobacco products, your health will improve and your risk will go down. Your risk for cancer, heart disease, and stroke will reduce, along with those other symptoms related to chronic smoking, such as coughing, wheezing, and shortness of breath. There are several methods for quitting. Many of you are familiar with gum, patches, spray, lozenges, and the two medications that we have are Chantix and Zyban. This concludes your lecture on tobacco. Thank you for your attention.